Good day, dear brothers and sisters in surgery. So happy to be with you. And a very crucial question have been asked frequently the past days regarding, can I pass by just studying those last 50 days before the exam? It's a very critical, tough question, even for me. Yes, you can. You can, but with conditions. You have to know that this is just a critical time and there is no way to play around. You have to dedicate your study. So, what can I do in those 50 days to make this happen? You have to dedicate yourself. Close any duty for your exam. You have to be studying only. Yes, studying only. And study according to the exam routine and the exam style. Our schedule for 60 days, you have to compress it and make it 50. The basic science is the main bulk of this exam. You have to master the basic science of this exam because 180 mark only on basic science. And 70% of the basic science is anatomy. Anatomy is overlapping with many chapters. You have to master anatomy. If you have mastered anatomy, you have mastered all. So practically speaking, master the basic science. And 50 days, you have to take only 1 week to finish all the basic science. When I'm talking about basic science, talking about anatomy, physiology, microbiology, and some of the pathology. But mainly anatomy, microbiology, and physiology in 1 week. So you will have a complete month before the exam. The last 2 weeks will be strictly for records, only records. And you have to read the records pre-answered. They are found on our group. Please go for them. Read them and share them and discuss them even if they are answered. You have to discuss with our friends. Take the frequent mocks in our schedule. Don't let the exam be your first attempt to study in the first day of the exam. Please take the frequent mocks. After finishing the basic science, you have to complete the ortho, endocrine, and the trauma, preoperative and postoperative. Those topics will be finished in 1 week. So the first 2 weeks of the 50 days, basic science, the second will be ortho, trauma, preoperative, postoperative, and endocrine. If you have finished those, you have finished the next main bulk of the exam. And now, after finishing those, start records instantaneously, immediately after trauma, ortho, preoperative, and postoperative, and endocrine. Please start records. Starting with Fawzia sheets. Can I answer them? Yes, you can. You can do. So go for them. Read them pre-answered. Don't test yourself in a new question by now. Just read it pre-answered. Please, you can do it. Read them pre-answered. They are found in our group. We have prepared all this for you. Just you can do it. After this, you will find that you are going side by side the rest of the topics besides the records, and you will do it because they are all depending on the basic science. In MRCS, they are not just asking you about deep information. They are asking you about the logic, and you will know the logic. That's why we are asking you to read the pre-answered question and not testing yourself. And when we ask you to test yourself, we ask you to test yourself in the pre-answered questions and the mock of the day in the same topic you have read. This is the trick. Yes, you can do it, but dedicate yourself for studying, only for studying the 50 days. Otherwise, postpone. Yes, you have to know what you can do. You can't do it beside your work. I don't want to be pessimistic. I'm always optimistic, but be realistic. If you want to do it, so make it happen. Work on it. You can't be working and making all your duties and no studying and saying, I have exam, I will go for it. No matter how genius you are, you have to study with this exam style. Otherwise, it's your own risk. If you want to take this risk, take it smart. Think about it. Again, take the basic science, then also trauma, preoperative, postoperative, and the endocrine. And after those, take side by side the records starting with فوزية sheets and the last records of the 5 years. If anyone have any question, please post it on the group. It will be answered faster than the private messages. You are most welcome in the private messages, but with lots of messages, I will be delayed in the group. Me or any friend will be happy to share. This group is made to be sharing with happiness and with selflessness, and this is what we have been doing all along since the start of this group. So happy to have been with you. May God be with you. You can do it, and together we can. You are a surgeon. You are entering the operating room to make it happen, and we are in this group studying to make this exam happen, to be your joyful success with the grace of God. So happy to be with you. Any question are most welcome anytime. Go for it, Tigers. Thank you. So happy to have been with you.